Catching up with three of the candidates running in District 4. The Central Alabama District includes areas like Marion, Coleman, Blount, and Etowah counties. Here's a look at who's running. Two Democrats, Lee Aumann and Rick Neighbors, are both competing for their party's nomination. We'll also hear from Republican Anthony Blackman, who is challenging GOP incumbent Robert Aderholt. I asked him about health care and how to ensure rural communities have better access to it. Many of these areas struggle with issues like infant mortality and a high rate of diabetes. In fact, according to the American Diabetes Association, more than 15% of adults in Alabama have diabetes. Lee Aumann wants to see a multifaceted solution to include expanding Medicare funding in the long term, in terms of today's needs in our rural communities.
As far as immediate solutions go, I think making it easier for rural hospitals to get status as critical access hospitals would be a big step. That would allow them to get more funding and more protection from the government to stay open in rural areas.
Fellow Democrat Rick Neighbors says when Alabama didn't expand Medicaid, rural hospitals started closing their doors. He wants to protect those hospitals and also find ways to provide affordable health care.
We have to come to terms with what we want as a people. Is life important? Is life important for all people, or only for people who have money? And if we decide that life is important, then we as a people need to support that, which includes health care for those that need it.
I feel more like I am one.
On the Republican side, Anthony Blackman says addressing rural health care means addressing the overall system. He's an advocate of health care cooperatives and buying health insurance across state lines. He wants to see options for basic low-cost monthly health coverage in addition to separate catastrophic coverage.
You will not be using the insurance to, do your common colds and stuff like that. So what that's going to effectively do is take the shock load off the insurance. So they're not paying for that. And that's where that healthcare cooperative come in. So I think if we could go to a system like that, maybe across the board, I think that would help drastically with the rural health care.
Now, we invited Congressman Aderholt to join us for an interview. He was not able to make it. Tomorrow, we're going to hear from the candidates about addressing the pay gap between men and women.